tonight's webinar is by utahmarijuana.org, and I'm Tim Pickett, a medical cannabis provider here in Utah. We're going to do just a conversation really around PTSD, and I am so happy that we have an expert essentially on PTSD and behavioral health, Cliff Ackerman. Will you introduce yourself, Cliff, and talk a little bit about your background and you?
Yeah. Well, thanks for inviting me to this webinar, if that's what we're going to call it, the Medinar. So I'm a licensed clinical social worker, graduated from the University of Utah 2010. And so since then have been providing substance use, addiction, mental health services, clinical services, for the last, 12 years. And in a lot of different settings, cradle to the grave, all different ages. And where I'm at right now in my career, I think I've kind of, gravitated towards treating PTSD trauma, understanding really what that is, what that can look like for so many different people. I've worked with thousands of different people, one-on-one, in groups, with families, and also gravitating more towards, the use of medical cannabis in conjunction with trauma treatment or trauma therapies. So I also teach up at the U of U as an associate instructor, and I am currently the senior clinical director and founder of Altium Health, which is a addiction and wellness center out in Jordan Landing. But I'm just in the process of really trying to be a behavioral health provider in the medical cannabis industry, unlike I think anybody is doing right now. I think a lot of us are trying to figure out with insurances and philosophies of therapy and trying to break down all the stigmas and stereotypes around marijuana and cannabis, trying to figure out how a lot of us are behavioral health providers are trying to figure out how does this work and how can we make this work and be a good thing for a lot of people with PTSD. And so I'm really interested in continuing to kind of find the model that works for this in the medical cannabis industry. So
no, yeah. It's cool to have you as part of this, and I think we'll get into some discussions that I haven't been able to have with anybody in the clinical setting, from medical, regarding PTSD specifically and medical cannabis. So topics we'll try to go over tonight: what is PTSD, some symptoms of PTSD, what the effects of THC and CBD are in general, but also specifically for symptoms of PTSD. We'll discuss a little bit of the mechanism of action, what we think is happening. There's some of this we know, and some of this that's assumed, right? Mm-hmm. And you think, well, maybe we should know more before we use it, but frankly, we don't know the mechanism of action of a lot of drugs we use in normal medicine, quote unquote, right? So then we'll talk about suggestions and uses of medical cannabis, and at the end, I'm going to make a couple of product recommendations that I think are similar to products that you might want to try, or really products you might want to go out and try yourself. This webinar and more videos can be found at Discover Marijuana. This is a QR code. You can just take a picture of it right now. If you are not subscribed and you're somebody who is interested in medical cannabis, there are a lot of videos there. There's a lot of videos with me and Blake Smith, who's a bioanalytical chemist for Zion Medicinal. A lot of mechanism of action for other conditions. A lot of discussion around different forms and delivery. I like this YouTube channel, and there you go. Subscribe to that. So let's talk about PTSD in general. So Cliff, this is really your wheelhouse, right? What is PTSD?
Well, the way that you've got it listed up here, referencing the APA, American Psychiatric Association, So the DSM, the kind of the Holy Bible of Psychiatry, where we get all of our mental health diagnoses, disorders, would say anybody who's experienced or witnessed a traumatic event or been threatened with death, sexual violence, or serious injury. So that's one way to define it. But when I work with patients, and the way that I define it is, it's that negative life event that a lot of us may experience in our lives at one point in time in our life, that kind of leaves a sense of shock, internalized shame, grief, and makes us feel really bad about ourselves in a lot of different ways. And a lot of times the trauma is something that leads to detrimental development, and we look at it and we can't see any good from it. We can't see any positive coming away from it. So it just leaves the mind, the body, the spirit in a lot of distress. And so we later on, if we don't talk about it and we're not processing the trauma in order to kind of reverse the trauma or heal the trauma, then we end up having nightmares, flashbacks, lots of anxiety. Anxiety is probably number one when it comes to PTSD in terms of symptoms. And so that's how I would probably define PTSD. You got a list of symptoms right here. Again, nightmares, flashbacks.
Do you find that there are symptoms that are more common, like more common in this list, or is everybody really different?
Everybody's symptoms express and manifest differently in different kinds of ways, but generally across the board, the common things that I see is lots and lots of anxiety. And that would include social anxiety, sleep problems, insomnia, of course, the flashbacks and nightmares. But essentially one thing that kind of, is common between everybody with a PTSD diagnosis is this kind of state of hypervigilance, being very hyper aroused. So getting triggered from something or someone in some kind of setting or context, and having a really kind of bad, negative, distressing reaction to that. And so that could lead to some kind of flare up of, blowing up, acting out, getting angry and explosive, running away, avoiding, shutting down, hiding out and isolating from people is typically what I would see between, a lot of different people diagnosed with PTSD.
Is this something like with chronic pain, when we look at it clinically, we would say, okay, is this pain something that is affecting your ability to do the things that you want to do, right? So yes, that's the physical part of you use a physical symptom and then you say, well, is this actually harming your or keeping you from doing other things like your leg pain? Then I would say, oh yeah, you have chronic pain. We need to deal with that because it's affecting your ability to do things. Is right. That one of the criteria when you're diagnosing somebody with PTSD? Is it's not just I'm anxious all the time or I have these triggers. It's that right. I'm actually doing things differently because of the trauma.
Yeah, and with PTSD and all disorders in the DSM, you really can't make a formal diagnosis unless there's some life domain impairment. So between all of the people that I work with that have an actual precise, accurate diagnosis of PTSD, employment is disrupted. A lot of people have a hard time going to work or being at work. Relationships with family, spouses, children, friends, parents, siblings are pretty impacted, and there's a lot of relational distress that can occur and happen. And then, so many other life domains can be affected too. Sometimes in an attempt to escape or even avoid, a person can start to maybe self-soothe or use different types or forms of medication, whether it be legal and prescribed or illicit and off the street. And so sometimes with that kind of use can come, health problems, emergency room visits, sometimes criminal charges and incarceration. So anytime there's a life impairment, that would be, one criteria of meeting a diagnosis.
And is this done in is typically the diagnosis done with a paper evaluation. You have like a questionnaire people fill out, and
Yep.
then you score it, and then you take that with a behavioral health like evaluation.
Yep. So typically we use, there's so many different instruments, but we use the instruments that are kind of were developed and certified by the VA, which diagnosed PTSD originally, when it was, came along to be a formal diagnosis, was with military, coming from post-deployment and combat. So the VA has a lot of specialty in diagnosing and screening for PTSD. So we use what's called the LEC-5 and then the PCL-5, which screens for the life events and the symptoms. It's like a symptom checklist. If that has a positive suggestion for PTSD, then we do a full-on behavioral health assessment, which takes about an hour. And we look at self-reporting, we look at presentation in the symptom, we're making observations around the information that's being provided. And then we do, a collateral kind of clinical collection of documentation from other providers or history of providers. Now, what we notice is most people that I work with, chances are, have some kind of trauma that's still affecting or impacting them and causing some disruption in life domain. And a lot of times we look at a diagnostic matrix, how many symptoms or sets of symptoms come into the picture or with that patient that might indicate a particular mental health diagnosis, like anxiety and depression and bipolar and those kinds of things. And what we notice is a person that comes in with a history of one or three or more diagnoses in their diagnostic matrix, chances are that is all falling under the umbrella of a PTSD diagnosis.
Okay, this is, I think in medicine that I've been that I have experience in, it is much more, it's 15 minutes. I got 15 minutes, 20 minutes with the patient. We're going to talk about it real quick, and then I'm going to pick a medication to put them on. And that is not what you're essentially saying is that doesn't really help people, in some ways, right?
It's part of it. It can help, and it's part of it, but it's not the end of the road for a lot of patients, for sure.
Right. Okay, so in Utah, PTSD is the only condition that is in the mental health world, in the behavioral health world. PTSD has to be diagnosed by a licensed one of these psychiatrist, psychologist, LCSW, psychiatric APRN, and you also have to be in ongoing treatment. So it's the only condition in Utah that requires not only the diagnosis, but you must be in ongoing treatment, right. Which I think is a good thing. Would you agree with that?
Yeah, I mean, I think people have a hard time when they feel like they're forced to do something. And so if a person has choice and control and they're getting good quality therapy, to treat trauma takes a lot of expertise. And so I think most people probably would want good therapy over the long term. We screen patients and we say, how long do you think you want to be in therapy? And most people with a true, precise, accurate diagnosis of PTSD are wanting to be in therapy for a year or more because there's so much that they need to be worked through and be able to process.
So let's talk a little bit about, we're not going to go through these very much, but there are some studies, and I find these are particular ones that I picked out. So some Israeli research is very interesting. They have given 100 grams of cannabis flower per month to some of their soldiers, right? 100 grams, that's a lot of flour, okay? In Utah, 4 ounces, 113 grams. So we're talking more than 3 ounces, 3.5 ounces of flour. You're smoking more than not quite an ounce a week. I don't know how much in this study the patients were actually using, but they're measuring symptoms before, they're measuring symptoms after, and they're showing really good results with access to cannabis flower in this study.
Right.
In 2017, there was a really good review too about CBD specifically, that it produces an enduring reduction in learned fear expression. So one of the things that we'll go into, and maybe we have a slide on it, I don't really know, but what's happening from a brain chemistry standpoint is you're building calluses between the amygdala, the emotional part of the brain, and the frontal lobe, which is your reasoning. And you're building these pathways that it's hard for the brain to get out of.
Mm-hmm.
And that is what we would consider learned fear, right? So that if we can reduce that learned fear, then in theory, we can reduce the impact of the trauma to the patient's life experience.
Right. Yeah. Lessening the anxiety, reducing the symptoms so that we can slow things down and lessen the way the reactivity that a person often, exhibits, to be able then to, do more work below the symptoms of it all.
Yeah, so that makes sense. You're basically kind of utilizing it to soften, to kind of like soften the clay so you can mold it a little better.
Yep.
Right?
It's a great analogy. Yep.
Okay, so the effects of Delta-9. This is kind of a fun little video where Blake
what's happening in the body chemically with depression? Why is cannabis good or bad? Yeah. Tell us about that.
If someone is having depression, this is not going to really inspire you not to be depressed, right? This is just a chemical explanation about this, and really, work with your doctor. Everyone deserves to be happy and have joy. It's not just the interplay of dopamine by itself. It's melatonin, it's serotonin, and you have a whole slew of other neurotransmitters that are all oscillating. And so what you're trying to do is get back to homeostasis, or this natural, typical curve.
Yes. I show that because
what's happening?
Partly because if you want more information about this, you can go to Discover Marijuana and you can listen to Blake talk a lot about stuff like that. All these different pathways that THC and CBD are affecting, and really not necessarily what we're talking about here in depth, but that's the chemical kind of explanation of how these things are helping. Because CBD and cannabis in general is really trying to get the body back to homeostasis.
Yes.
It's a very, very interesting substance that will stimulate certain pathways in the neurons and inhibit other pathways in order to maintain that balance. And that's it's what you and I really like about the cannabis treatment in general. We find that the things that cannabis can be really good for is improving sleep, decreasing anxiety to a certain extent if you're using it correctly in the correct dosing and delivery forms for the patient. Having the right kind of intention around the cannabis use tends to help lower anxiety, anger outbursts, and avoidance behavior. And have you found, Cliff, that the avoidance behavior goes down? Like, this is somebody who doesn't want to interact with that individual because in the past they had a traumatic event with somebody who looked like that.
Yeah, or sounded like them. Yeah.
Or sounded like that.
Or said the same things that they said.
Yeah.
I think that, with the use of cannabis, and a lot of times I think the CBD, when that's part of the ratio, a lot of these symptoms are lessened. I think when they're in session and doing therapy, then because trauma is really memory. And so you have a traumatic memory with a lot of feeling embedded in that memory. And so anything that triggers the memory is going to trigger the feeling. So if I have somebody that's coming in to do trauma therapy and it's in conjunction with medical cannabis, then they have a whole hour that they can sit without running away and really confront and face the memories and then process the emotions. The trick in the trauma therapy, which is why I love the use of medical cannabis, because it allows the person to be able to release and relinquish themselves from those feelings, being calm enough and slow down enough and less anxious, less anxious enough to be able to, have a really good cry. And a cathartic moment like that releases those emotional molecules, which are just really built up toxins stored in all of those old memories that's creating disturbance internally. And so that's what I love about, the medicinal cannabis.
So are you specifically having certain patients, or are certain patients choosing to use cannabis during their sessions?
Yeah. I mean, whether it's cannabis or an anti-anxiety pill or an antidepressant, typically people who are on some form of medication are taking their daily dose in the morning before they get up for the day and get ready and do something with their life, including therapy. So if it's medical cannabis that they're using when they get up and before therapy, that's what they use. And oftentimes, if that's what they do, the therapy session is just much more meaningful for them and much more quality with the time that we have to be able to work through and process things that they normally would be hyper aroused by, hyper reactive to, avoiding, not wanting to talk about, being afraid or too anxious to talk about. And sometimes the medical cannabis actually helps restore the memory, because a lot of times people don't remember what there is to talk about and they can't recall what to talk about in the first place. And that's just because of that hyper aroused kind of, state of mind that they might be in, or that hyperreactive emotional state that they might be in. So if they take their medicinal cannabis in the daytime, in the morning, when they get up, they come to therapy, they're much more able to remember and recall, have an emotional release, and then be able to kind of confront and face those fears without all of the anxiety.
I love this. And I don't think there's enough of this going on in, certainly we're not talking about it enough. And I think people really need to hear that this is an option,
Right.
And when you talk about like the mechanism of action, which is the next slide, which we don't really, this isn't something that I want to spend much time on in detail, but cannabis enhances the present by disconnecting us from our short-term memory a little bit, but you're bringing up that you can access these long-term memories, and it seems like that would be more clear because there's not so much distortion or noise. There's not so much noise in the mind, right? You're able to really focus, like you say, and slow down and talk it out, right?
Right.
And like you say, have a good cry. I think there are a lot of us, and probably even in the participants in the audience here, that have experienced that, right? It's not all just euphoria and giggles with cannabis. There are times when you can have an incredibly meaningful conversation with somebody,
Right.
and learn a lot about yourself and about your perception of reality, and very, very meaningful experiences.
Right. Getting real with some stuff. The other thing too that I don't think most people realize is that in trauma work, even being able to talk about these kinds of things in session, and a lot of times people are sharing things in ways of themselves that they've never shared before with anybody else at all, because it's been so buried and it's been kind of trapped and contained in shame and secrecy. Because the person feels like, it was their fault, they're to blame, they did something wrong, they weren't good enough, there's something wrong with them. Now, the thing that most people don't realize is that, after that session, because that person has been able to disclose so much in such a vulnerable way, it likely will leave them feeling insecure when they walk away and after they go home, questioning, should I have brought that up? I shouldn't have said that. I shouldn't have told him that. I wonder what he's thinking about me now. So there's a really can be in trauma work after a really good, meaningful, positive session, a whole lot of, increased anxiety and insecurities in the aftermath of it. So that's one thing that I also think that, medical cannabis can help with. Oftentimes I tell my patients, go home and take a good nap and try to sleep really well tonight. And the one thing that helps them sleep and take a really good nap so that their brain can do pruning after all those oxytocins are released because of that good cathartic cry is use cannabis to help them get there, to lessen the anxiety and to help them get to sleep so that their brain can do some repair work.
I think the other thing I would add to that is allowing the nice thing about having a therapy session and having a professional that you work with, or a really, really good friend, somebody that you have as a trusted confidant, giving you permission to be vulnerable so that you don't have that. There is this anxiety associated with THC use as well. And a lot of times people have to give themselves permission to talk, right?
Right.
And to be open and to use and to be a little, be a little stony, I guess, for lack of a better word. Nathan has a question, but we're going to get to that in just a second. And I think we can help with that question. So this slide talks about the mechanism of action of the endocannabinoid system, which really the key word there is modulation. So we're creating things, we're consolidating things, we're trying to get back to a balance. We're trying to get back to this homeostasis, and we're using the CB1 and the CB1 receptor system is in the brain and the nervous system, and the CB2 receptor system is in the tissues, and we're using both in trauma therapy and PTSD therapy. There's this hypothalamic pituitary this is emotional brain talking to the frontal lobe. That's the simple version of that. And then the 5-HT1A, that's that serotonin kind of pathway. That's that depression pathway that it's modulated a little bit, not so much activity with depression, specifically with THC and CBD use, more help with anxiety in that part. So let's move on to some interesting stuff. So the tinctures and edibles, I want to remind everybody that tinctures and edibles are going to be a slower onset to peak effect. You're looking at, I would say, 1 hour to 2 hours to peak effect. You're going to have a slow decrease over the course of 4 to 6 hours, typically with oral methods of cannabis. Really good for consistent dosing. And if you're taking it morning, noon, at night, if you're taking it at night, tinctures and edibles tend to be really, really good because they last a long time and you can sleep. And then you have flower and vaporizers, inhaled methods, which are quick to action, but they decrease over a shorter amount of time, much more rapid. So this tends to be good for triggering events, things that you either know something is going to be triggering so you can dose, or you have a triggering event and then you dose, where an edible or a tincture is going to take a little too long to take effect. And this kind of goes to the question, and I'll read this question out. So the question is really around, so there's edibles before bed, but found myself super groggy in the morning. And over the last few months, he switched to a drier vaporizer, usually a 1-to-1 type strain. So that means 1 part CBD, 1 part THC. We'll talk about that in a couple of slides coming up. Does not have the same effect, meaning not groggy. I'm hoping that I'm getting that right. any suggestions on methods might be better that will leave me functional in the morning. So using these two slides as your guide, right? If you're using a dry herb vaporizer, you're only going to get effect for between 2 and 4 hours. But if you're using an edible, you're going to get effect for a long period of time. So usually it's depending on the dosing and how long before bed or how early you wake up. And we can get a little more nuanced than that with absorption. Absorption can happen depending on what you eat, either slower or faster. So if you ate a high fat meal, you might have more effect because it's absorbed with the fat, and that may actually last longer as your gut slows down with these big meals. So you can tend to get an 8 to 12 hour, sometimes almost high from an edible, and leave people groggy in the morning. So I think if the question is trying not to feel groggy in the morning, then the answer is using shorter methods like flowers. That's the answer. If the question is you want to sleep as good as you did with the edible and you're not getting that effect with the flower, that's probably strain related or level of dose related, more so than the duration of effect. And there's a couple of suggestions in my last slide about products.
Right. Is it also possible too that with, the edible before bed, that all has to digest, and then it has a longer, span of time to kind of take effect and stay in effect?
Yes, because you might only be absorbing 1 or 2 milligrams at a time, and you might be absorbing clear through the night.
Right.
So
go ahead, Tim.
No, go ahead.
I was going to say, so just, my part as a therapist, as a medical cannabis therapist, because, we really want to try to have the greatest and most positive effect of what's being consumed, be on the most effective of the least amount of things, right?
Yes.
So something that I'm seeing here now, if Nathan came to me to therapy, I would probably really want to explore, right? What is the antidepressant? What is the anti-anxiety? And what kind of edible is it? What, strain and ratio is it? Because I don't understand the interaction risks between all of these things, but I would want to also understand, because sometimes if I wake up groggy and still tired, something's been flooded, chances are. And you got an antidepressant and an anti-anxiety, depending on what types of medications those are and the dosage that he might be on, in combination with the edible, whatever that is, could actually be, not the best concoction or mixture of medication. So I'd want him to explore that and really then talk to somebody like you, and see if there's a way to get on the least amount of the most effective. And as a medical cannabis therapist, I typically would tell my patients, gosh, you know what? Think about, one or the other. I mean, medical cannabis is very, natural, organic. It's a plant-based medicine. And the antidepressants and anti-anxieties are, come, from the lab and are, based, it's a pharmaceutical.
Yep, completely synthetic. Yep.
Synthetic. And so you never know, and there's no current research that tells us, hey, this is what happens when you put these things together in your unique body. So that's the kind of conversation that I would also probably want to be having as well.
And that brings up Colin's point, which is here that it's best to start low and go slow and then keep a journal. So keeping a journal not only of your cannabis use, but of your other medications that you take, and maybe even what you're eating for dinner. I know that these journals, we don't want these journals to be so detailed that you're not going to do it. But if you have a set of things that you're tracking, and then a couple hours later, how you feel, especially with cannabis, if you're tracking how much you take and when you take it, and then how you feel a couple of hours later, then you're then you're going to, over time, you're going to get a sense, you're going to be able to go back and get a sense of what's working and what might not be. But the whole point of a journal is to keep the record. And like Nathan said, I mean, if you're tracking too much data, you're not going to do it. So
Right.
only track enough data that you're going to do it every day or do it every session. And over time, you find like, I definitely have things that I will not take at certain doses. I promise you, I am very, 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 very specific about a couple of things. Let's talk about that specifically, what to take and what to look for PTSD and mental health really, and maybe what to avoid a little bit. So terpenes are found in everything, right? When you go through the forest and you smell, you're smelling pinene. When you eat a lemon or smell an orange, there's a lot of limonene in that. Myrcene is the most dominant terpene found in cannabis. It's up to, I think, 4% in some strains, but definitely the most common. Linalool is very much like lavender. That's the smell that we have. And caryophyllene, beta caryophyllene, is a common anti-inflammatory terpene. It's very common in strains that tend to help with chronic pain. But these three are my favorite terpenes when it comes to PTSD symptoms. If you're looking if you have the ability to look for terpene products with these terpenes either added or these terpenes are dominant in the flower, then these would be pretty good. The cannabinoids, there's about 120 cannabinoids we know of. THC is a cannabinoid, CBG, CBC, CBD, and CBN. CBN is known for its relaxing properties. It's known to be very calming. It is very good for sleep and calming anxiety during the day. So if you're looking for products with cannabinoids or terpenes that may help a PTSD type of condition, these would be where I would start. And you can find this particular graphic on utahmarijuana.org, and you can find information on terpenes. It's readily available online. Terpenes are essentially essential oils, right? Which is a really common thing in Utah to treat things. One warning about terpenes: you do not want to inhale terpenes on their own, right? You're not vaping terpenes. Don't vape your essential oils. That is very, very dangerous. It's not recommended. And you'll notice in these products, there's a very small percentage of terpenes added because they can be very strong in low doses. And then product recommendations for me, I'm going to tend to recommend indica or hybrid type products. A couple of things in Utah that are fairly common and easy to find are ice cream cake and do-si-do. Do-si-do is a vape cart and a flower. There's a bunch of different companies that make these products with the do-si-do kind of breakdown. The only edible that I could find with a breakdown of what's actually in it was a Zion Medicinal, the plush wild cherry gummies. And the reason why I like this one is because of the ratio. I think you want that ratio of THC to CBD, which brings me really to my favorite products for PTSD and for new patients, which are tinctures. I recommend ratios of 1:4 up to 1:10. THC to CBD. If you go back in our slides, you'll find that CBD research is really good. And CBD tends to smooth out the rough edges of the THC effect. And so patients who use them together tend to have better sessions when they're in that 1:4 ratio, or at least 1:1 ratios. Cliff, do you have any favorite products?
Yeah, I think anything that is higher CBD, lower THC, for me and my patients, the 1-to-1 sometimes can be a little too much. The 1-to-4, what do they got? 1-to-10, 1-to-30. Um, and then, some people really do like, flower, and there are flower products out there that are, mostly, if not all, CBD with a little bit of THC, which can be really helpful. But they've got, vapes and tinctures and edibles. But I think for me and my patients, the tinctures are great, but edibles tend to kind of be what I hear a lot of, my patients using a lot more is the edible.
This is a good slide for reference for dosing. Just like Cliff was saying, the 1-to-10 THC to CBD, that seems to be a really good sweet spot for people who are new to cannabis, to people who want to decrease anxiety, help their sleep, right? Decrease their dreams. That 2.5 to 12.5 milligrams per dose also seems to be, when you look at the evidence, we tend to come to this 7.5 to 12.5 as the sweet spot for THC dosing. A lot of that is around, if you get too much THC, the brain starts to spin, and you're watching the waterfall. You're behind the waterfall, and it's just going and going and going, and that can ruin your sleep.
Especially the sativa. And if you're already if you already come with a lot of anxiety, and anxiety is a big part of PTSD, but if you already have a lot of anxiety and then you're using really high dosages of THC and sativa, that chances are you're probably going to get a little bit more paranoid. Anxiety can turn into paranoia if your brain is, overactivated.
The last thing I'll say before we get to questions is, if you're concerned about the high, start with CBD, 1 milligram per kilogram. So take your body weight in pounds, divide it by 2.2. That's your kilograms. 1 milligram per kilogram per day. Start with that, right? So I'm 170 pounds. That's, 75 kilos. So I'm going to take 75 milligrams of CBD every single day divided. So I take a slug, I call it, just take a good slug in the morning, good slug in the middle of the day. And that will help on its own without any psychoactivity, and can be used during the day because it's not psychoactive and you don't get that high feeling. So let's go to some questions. We've got a question about a teenage child who's been diagnosed with PTSD, at a loss for how to handle the Compassionate Service Board. Yes, I have some comments about that. If I have any advice, she has a diagnosis from her therapist, who's an LCSW. Her therapist is supportive, but not a QMP. So this is a great question, and there's a couple of things about this. So, like Cliff is an LCSW, right?
Yes.
Cliff? So
yes.
Cliff is not a QMP, cannot be a QMP under state law because he doesn't have a controlled substance license or a license to prescribe controlled substances in Utah. That requires somebody like me, a PA with a controlled substance license. So in this case, no matter what, if the patient is diagnosed with PTSD from a LCSW and you then go to see a QMP, you can take that diagnosis and that letter of treatment, and you can then get a recommendation from the QMP for medical cannabis. So these two things go together, right? You're going to get the cannabis recommendation from the QMP. You're going to get the help and the therapy from the clinical social worker. And I hope that makes sense. That's just in general the process. Then you add on to that the Compassionate Use Board for somebody under 21. So that application has to be done through the QMP with help from the social worker. So there's an entire application process that has to be done. They have to take that application to the Compassionate Use Board, which is 7 physicians in Utah, and that board will make a recommendation for medical cannabis and allow them access. And then you as the parent have to have a guardian card or a caregiver card to help them access that medication if they're under 18. The process takes 1 to 2 months, and really, if the patient is between, if they're 16 and over, you can go to utahmarijuana.org and you can see us. We will help. The Compassionate Use Board has been a little hesitant to use specialist providers as QMPs. It's a tricky scenario, but we can help guide you through it. And so give us a call. We have somebody who's actually an expert on the Compassionate Use Board and does all of that for us. So hopefully that helps. And we can get you more resources as well. Okay, perfect. I'm going to answer that one. There we go. And then we had a nice comment. Very, very thankful to us for, we're exploring the cannabis family. Yeah, thank you. I don't know if it's Jeannie or Jean, but thanks for those kind words. Yes, Cliff and I actually really like this stuff.
This is fun.
I don't know if you noticed, but we're kind of all jazzed up about this topic, right? Like I'm fascinated with the idea that you can manipulate the mind and you can change behavior and you can change your perception of your own life and your experience. I think that's so important. And I think that's missing with modern medicine. I just feel like a lot of the times we just prescribe and dull everything.
Yeah, yes.
And cannabis is like a turning point. It's not about the cannabis. The cannabis is just unlocking something that is allowing us to take a step forward in our life and in our growth.
And there also may be some healing properties too. I mean, I think for me, I, grew up as kind of a delinquent youth. And so I was in the system a lot. And so as a way to prevent youth from getting into trouble, they made us feel like, all drugs and alcohol were bad and to never use it. Well, when my brother had diabetes and went blind because of glaucoma, he started using cannabis and he brought his vision back. And with all the people that I've worked with, especially when I worked in the jail and I ran a program there, we could not talk about it, yet most of the people in there were in there because of drug charges, and a lot of it, marijuana, and we're also using cannabis when they weren't in jail. Sometimes they would use it in jail too.
Oh my gosh.
But we couldn't talk about it. And so, in the last couple of years, as I've been working more with patients with trauma and seeing, how much this can help and have healing properties, I think it's something that I want to be a part of and be involved in the conversation about, for sure.
Yeah. Okay, we have a last question, and it is perfectly timed. So thank you, Nathan, for asking it. And that is this. Any recommendations to find a therapist willing to work with a cannabis patient like him? Well, yes, there you go. Call Cliff. And you can get a hold of Cliff by reaching out to us, because that's not part of this presentation as far as like our, and I think, probably just an oversight on my part, frankly, Cliff, so sorry. So go to utahmarijuana.org, reach out to us, mention the webinar. We will set you up, right? We'll give you all the information you need. And you can just call our office. We have locations, and Cliff's going to be involved with us clinically in our locations, specifically in Bountiful, if that's somewhere that you want to go. And I'm sure, to be honest, I want to do it, because I'm just interested in utilizing cannabis, like going to the next level and getting really serious about my mental health, and use some cannabis. You can also follow us on Twitter, Facebook, Instagram. You know, we're on all the things. And at the end of this, hopefully, if you've signed up for this, then there'll be a feedback poll. So we really appreciate the feedback. One way to get a hold of me or Cliff is when this is posted on YouTube. If you make a comment on any of the videos that I have, we answer all those questions. It's better than email because when we answer the question, we get to answer it for everybody and not just keep it a secret for only you. So that I think that's the best way to get the information out is just, you know, go to YouTube, comment away, and we'll get it. Anything else that we missed, Cliff?
Nope, I think that was great. I appreciate it. Sounds like everybody had a good time. The one thing I wanted to mention is if you can't journal, some people have a hard time writing and tracking stuff. Come to therapy. Let me be your journal. I'll keep a documented record of it. Every time you come in, we'll measure it. Every time we'll send it to Tim, and we'll all work together to make something work for you in the best kind of way.
That is a great idea. All right. Thanks, everybody. Stay safe out there, will you?
See you later.